Start.
Good morning. This morning we're going to have Anne-Marie tell us about the Blu Light and how it's going to help our patients with precancer. And Anne-Marie is our esthetician here at Contour Dermatology.
So the Blu Light is a two-step process where we apply Levulon to the area being treated, and then we let it incubate for a specific period of time. For the face and scalp, we let it incubate for an hour. And then for the extremities, we let it incubate for a minimum of 3 hours. So, so that it can absorb and be utilized by the Blu Light.
Actinic keratoses are precancerous growths that appear on the skin. It usually appears red spots that are rough to touch. They have a fine scale on them.
They're typically evolved from photo-damaged skin that occurs after years upon years of sun exposure. And they are pre-malignant in that they're the precursor to squamous cell carcinomas.
As a young teenager, your idea for the summer was to get a beautiful tan because that's what people thought was very healthy. And I can remember sitting out in the backyard on the chaise lounge for hours on end, just trying and trying to get a tan. No sunscreen, no anything.
I'm from the town one over from Jones Beach on Long Island, and we literally lived on the beach for a while. You know, back then you used to put things on your face to draw the rays in.
Excess exposure to sun has been the factor that's associated with the development of these precancerous lesions. Susceptibility to these actinic keratoses occurs in certain populations, particularly people with fair skin, people with light hair, blue or light eyes tend to be more susceptible. People that burn easily tend to develop these earlier in life.
And they present clinically as red scaly spots that, rather than a normal dry spot on the face that would heal in response to moisturizer washing the face, continue to be rough and scaly after the face is moisturized. So they occur most commonly on sun-exposed areas of the face.
Definitely sunscreen, sunscreen, sunscreen.
Hindsight is 20/20. When I was young, I was a lifeguard in high school and college. I also started boating in my 20s, which I've continued. And there's no way to avoid the sun if you're going to do that.
You know, when I tell people that they have actinic keratosis, they have no idea what I'm talking about. And they don't understand the significance. And I don't try to raise any alarm bells. I really try to minimize the impact of this on them. I tell them that it's a very common type of growth that's easily treatable, that it can be a precursor to skin cancer, and that's why it's very important to treat this type of growth.
It's really not well studied in the literature exactly how many years it takes for an AK or an actinic keratosis to progress to an overt squamous cell carcinoma. And that's one of the reasons why it's very important for patients to seek early treatment for actinic keratoses, is that some of them progress very quickly into a squamous cell carcinoma, and some of them take years upon years to progress.
The most commonly used treatments for actinic keratoses are destructive treatments.
There are a number of treatments that we do when we start to see early actinic keratoses on the face and the scalp. One of those is photodynamic therapy.
What is Levulin Caristic used for? Levulin Caristic, aminolevulinic acid hydrochloride for topical solution 20%, plus Blu Light illumination using the Blu Light photodynamic therapy illuminator is indicated for the treatment of minimally to moderately thick actinic keratoses of the face or scalp.
I'm a sports coach, and my job as an athletic director is being outside all the time. I'm obviously supposed to be putting sunscreen on every day. I'm not very good at that, and I'll be the first to admit it. So this treatment was excellent for someone like myself because I go to the doctor treats me.
Levulin PDT is administered in your doctor's office by a qualified healthcare professional. Ask your doctor if Levulin PDT is the right choice for you. Levulin PDT is a two-step treatment procedure in the treatment of minimally to moderately thick AKs of the face or scalp. Step 1 includes the application of the Levulin Caristic topical solution. First, Levulin will be uniformly applied to your AK lesions. Next, your healthcare provider will direct you to wait the recommended time in order to allow the solution to penetrate the targeted cells. During this time, you should avoid exposing the treated lesions to sunlight and other forms of bright light for at least 48 hours. Examples include outdoor activities such as golf or household lights at close range. Sunscreens will not protect against photosensitivity reactions caused by visible light during this time. Step 2 is the Blu Light treatment. Before your Blu treatment begins, the AKs to be treated should be gently rinsed and patted dry. You will also be given protective eyewear that should be worn during your entire Blu treatment of approximately 17 minutes.
It's very important when administering photodynamic therapy to patients to prepare them for the eventual results and outcomes of treatment. This is what we call a phototoxic therapy, meaning that we're putting on a medication on the skin that sensitizes the skin to visible light. We're then exposing the skin to a blue light in visible range, which activates this chemical.
Who should not use Levulin? Levulin Caristic should not be used by patients who have cutaneous photosensitivity at wavelengths at 400 to 450 nanometers, porphyria, or known allergies to porphyrins, and in patients with known sensitivity to any of the components of the Levulin Caristic for topical solution. Levulin Caristic has not been tested on patients with inherited or acquired coagulation defects. It is possible that concomitant use of other known photosensitizing agents might increase the photosensitivity reaction of actinic keratoses treated with the Levulin Caristic. It is important to tell your physician if you are taking any oral medications or using any topical prescription or non-prescription products on your face or scalp. Tell your doctor if you are pregnant or nursing.
One of the biggest questions that we get is, what am I going to look like afterwards? And what you're going to look like afterwards, of course, depends on the patient and how much sun damage they have. Generally, we tell them to expect some redness, pinkness. They can have some flaking.
Telling them about the side effects immediately, the side effects down the road and over the first few days, and also making sure that they avoid visible light exposure during the first 48 hours after treatment is extremely important to minimize side effects.
What are the possible side effects? The most common side effects include scaling, crusting, skin discoloration, itching, stinging, and/or burning, redness and swelling. Severe stinging and/or burning at one or more lesions being treated was reported by at least 50% of patients at some time during the treatment.
I think the key is to get the information. Everyone is different. Don't be reluctant to ask your dermatologist about this.
I would encourage anybody who has actinic keratosis to investigate and look at the internet, talk with your physician about the use of PDT for treating AKs. I think with the great problem today with skin cancer, anything that you can do to treat precancerous conditions like AK can be, I would encourage people to look at all the treatments to take care of AKs before they become cancerous.
Important risk information. What is Levulin Caristic used for? The Levulin Caristic for topical solution plus blue light illumination using the Blu Light photodynamic therapy illuminator is indicated for the treatment of minimally to moderately thick actinic keratoses of the face or scalp.
So the rest of that is just a reiteration of what they already told you. Basically, what we do here is when we treat the face and the scalp, we let it incubate for 1 hour, and then we apply the blue light. If they've had one treatment, I spoke to the Dusa company rep that does the medical part of it, and he said to let them mature a little bit longer. So I'm going to let after the second treatment, them mature for about an hour and a half. And we don't just spot treat the AKs, we treat the entire area. So if they have AKs on their face, we apply the Levulon all over the face, not just to the visible AKs. And then for the arms and the legs, what the practice we're using is we let it mature overnight. So we're applying it Tuesday night and then doing the blue light Wednesday morning. And let me see if there's anything else you all have to know. Oh, we also use, you can also use the blue light for acne. You don't use the Levulon for it because the blue light actually attaches to porphyrins, and acne already produces the porphyrins. So, and then we use Dusa because there's lots of blue lights out there, but we use the Dusa machine because one, Dusa is the inventor of Levulon, and they actually have very specific science between the way that they have the lights, the nanometers that the light goes in. It goes in 5 millimeters, which is the thickness is more than the thickness of the epidermis where AKs occur. So they really did a detailed scientific research on how the light enters the skin, so that the outsides of the AKs get just as much light as the middle of the AK, so that the entire area is destroyed. So that's it.